Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is Monday, May 10th. We're doing our weekly video update a little belated from last week. Normally we do this on Thursdays, but we had to reschedule this time. I'm here again with Dr. C. Do you want to say hello?
Hi, everyone. Dr. Corriveau here. I'm the Deputy Health Officer for the UG Public Health Department.
Good to see you again, as always. So we have a few general updates on COVID vaccine things for later in the video, but the primary thing to talk about today is the Johnson & Johnson COVID vaccines, because I know we're all hearing about that in the news and there are rumors and lots of confusion around it. So hoping to hear from you as our one of our deputy health officer and a doctor in our area, and just kind of get a bit more info on what's been going on there. So can you start out by talking about what's the current status of the Johnson & Johnson vaccine?
Yeah, sure, Janelle. So there was a lot in the press about the J&J vaccine because even though it had received emergency use authorization and we had been using it, of course, in our health department, there were a couple weeks there in April when it was actually pulled and stopped. We put a halt on it. And the reason is that out of millions and millions of doses, there were a handful of women, generally in about their mid-30s, who got blood clots. And so there was this question, is the vaccine the culprit for that? And so after it was halted from use for a couple weeks, there was a big investigation about it, which is actually still ongoing. But it was felt that the vaccine confers benefit, a higher benefit than risk in the end. So it was fully investigated, and again, that's ongoing. But now the vaccine is again available. And we actually use it in Wyandotte County. And so we're using this in our mobile vaccine unit and at some of our community-based events for vaccinations. Just to give you a sense of how many blood clots there were approximately 8 million doses that were given, and about 15 people of all of those 8 million doses had blood clots. And so it's very, very rare, incredibly rare. But I think it was good to hold off and say, let's do some investigating about this just to ensure the safety. And so we certainly want to say that we want to ensure the safety of our community as well. But we feel like, it is still a benefit and confers a great amount of immunity against COVID-19, just like our other vaccines, the Pfizer vaccine and the Moderna vaccine. One of the advantages to the Johnson & Johnson vaccine is that there's only one dose necessary. And so that's awesome, one and done. And that can't be said for the other vaccines. The other ones, we have to give 2 doses. So a huge advantage.
Yeah, that's a really good thing to note. I know there's some people who maybe aren't comfortable with needles and that sort of thing, and like that it's just a one and done type of shot. And so what I'm hearing from you is that this now, after this pause out of, just caution to make sure that we did more safety review, it was unpaused by the CDC, the FDA, and I know the Kansas Department of Health and Environment as well unpaused it for the state. So it's still in use and still a good option to help protect folks from COVID-19.
That's absolutely the case. Yes, we've followed all state and national guidelines on that. And so we feel safe using it within Wyandotte County, and we've started to do so again.
Right. So I know that that's something that's available on the Saturday clinics that are at the Armory that are done in partnership with Donnelly College. There's something that we use for our mobile vaccine units, which we'll talk about more in a minute, and including for folks who maybe are homebound and they aren't able to come to the site. That way it's just one visit to their home, for instance, or other things where it's a site in the community and it's just that one and done and not having to schedule a follow-up. So that helps, make it a little bit easier for people to get their vaccination. All right. So we also will be kind of keeping our eyes and ears out for some additional updates on vaccines. It sounds like we might hear a little bit more later this week, and we'll keep people posted on that. I don't know if you want to say anything about that now or wait until later this week.
I'm going to give a little teaser, okay? We think that Pfizer is going to probably receive emergency use authorization for their COVID vaccine for children who are 12 years of age and up. And so that'll be really exciting, and we'll probably know a lot more on that by the end of the week. And then we'll probably have some really cool school and family events coming up in the near future as well in Wyandotte.
Yeah, great. So we'll of course have to wait for that authorization, but we're looking at what that would mean for getting folks who are 12 and up in our county vaccinated. So I want to jump into a few other quick updates before we wrap up. So we mentioned things about mobile vaccines. We actually we've been working to expand mobile vaccines in our area. So there is now, if you go to our website, wycovaccines.org, there is a button there where you can request mobile vaccines. So that again could be for an individual who has to stay in their home and isn't able to come to our site, but it's also for groups. So for maybe a business who wants to schedule vaccines for their employees, or an organization, maybe a church or another group in the area they have a group of people who are interested in getting vaccinated and want the vaccines brought to them. You can now request that online or by calling 311. So we have ramped up our efforts to be able to do more of that. And so we're really excited to offer that. Alongside that, and to be able to do it, we have adjusted some of our hours at our regular vaccine sites that stay in one place. So we do have some reduced hours at the former Best Buy and at the Armory. So the Best Buy for the next few weeks is going to be open Mondays and Tuesdays. And the Armory is going to be open Wednesday through Saturday. We are actually looking to close out the Best Buy site after this month, just because it's had some lower demand there, but we're going to keep the Armory and the former Kmart open. The former Kmart is continuing Monday through Friday. And that one, we're actually expanding hours one day there on Wednesdays. We'd had some evening hours and we're pushing those a little bit later so they go until 7 p.m. That way people have a different opportunity to come in if maybe, during the day doesn't work as well. So we just wanted to kind of give people the latest there on when and where and how they can get vaccinated in our area. You can also request transportation to come to those main vaccination sites. And that, similar to the mobile vaccines, you can request for individuals or groups. Some people request their family, like they'll have a family that will go together and get a ride to and from the vaccine sites. So a lot of different options for how you can get access to the vaccine in ways that are hopefully fairly easy to do and not take up too much of your time. We want to make sure everybody has that opportunity. All right, I think that's all we were going to cover for today. Okay, thanks so much. We'll see you next time.
Bye, guys. Thanks.